If I get COVID, I'm pretty sure my immune system will kick in and I'll be just fine. I
Yeah.
did not want the vaccine. I was willing to roll the dice. And then despite the fact, like, we all had natural immunity, most of the healthcare workers by that time had already had COVID. So they had natural immunity, but they were continually pushing this shot. And when they started pushing it for children was really when that was my line in the sand, because they were pushing the shot for children against the virus with a 99.9815% survival rate and with no safety data. That should be criminal, in my opinion. And I think that anybody, any doctor, any nurse, or any healthcare professional who said or even uttered the word safe and effective should be brought up on criminal charges, and they should be stripped of their licensure, because we had no data to say such a thing.
Yeah. So I guess there's some kind of law out there that was passed. I think during President Reagan's time, where if they approve it for vaccinating children, then they can't be held accountable.
That's correct. Yeah, a lot of people don't understand that once a vaccine is added to the childhood schedule, that removes liability protections across the board, and people don't understand that. They really, truly don't. And I was trying to get that message out to a lot of people back in 2020, 2021, that's what was happening. And that's why they were pushing so hard for these kids to get it, even though they were not at risk. They weren't even getting sick.
Wow. Now you've talked about how the intubation was for a lot of people, it was a death sentence. Tell us about how that came about.
It was, and I've been in healthcare for nearly 30 years. And I think that this is the most egregious thing that I have seen in my entire career, is these unnecessary intubations. Intubation is something that should be done as a last resort if the patient's in respiratory failure. But that's not what was happening. They were pushing for early intubation, and they were doing this not because the patient was in distress, or not because it would even help the patient, but because it was a way to contain the virus, right? If you understand, a ventilator is a closed loop system. Once the patient is on that ventilator, the virus is no longer disseminated in the air. So their rationale was to protect the healthcare workers. Well, we'd already been exposed to it by that point. So what sense did that make? And they did this knowing that approximately 80% of the patients we placed on a ventilator never made it off. So every single unnecessary intubation, we may as well have been signing, their death warrant.
And I see you made a comment about massive doses of fentanyl, propofol, and Versed, ensured that they basically were never going to come off too.
Yeah, you can't, because you have to do a weaning trial every morning that a patient is on a ventilator. You do a weaning trial to get them off and see if they can breathe on their own. But you have to get them the sedation off. And they were on such massive doses. And we're talking about things were so crazy there. And, people were not turning the meds down, and they weren't doing anything they were supposed. At one time, they actually started. I didn't do it, but they wanted us to have the IV pump outside of the room so we could minimize the interaction that we had with these patients who are already, by the way, isolated, away from their family, scared and alone. They don't even want the nurses going in there. And I was absolutely not. But they wanted us to pull the pumps outside of the room and have these like long extensions. There's no way it's safe to start making changes and titrating drips when you can't have your eyes on your patients. And that was another hard line in the sand for me, where I was like, absolutely not. But I really feel like that as nurses, we could have stopped so much of what happened. But unfortunately, as a profession, I feel like we failed in a lot of ways, because we should have stood up the moment that they told us that our patients could not have an advocate at their side. We should have said no. We should have said no. There are about 4 million nurses in this country, and we have the numbers. But too many, unfortunately, lack the courage to say anything.
Yeah, so you're going to lose your job, or be ostracized, and all kinds of crazy stuff. Now, we'll talk about this a little bit further. You have an advocacy. You have something to fix this, and so there's this system that is very corrupt, very harmful. And you've started a new system, which is very, very beneficial. So we'll go into that towards the end. And I applaud you on that as well, because that's something that it's critical. We have to lead the system that's doing this. And so let's 96 hours, they're on a ventilator. They're basically gone. But there's another reason why they want the 96 hours. What was that?
So they would receive financial incentives if a patient was placed on a ventilator. I don't remember the exact numbers. I want to say it was around $30,000 or $40,000 maybe per intubation per patient. And then if they were on that ventilator for 96 hours or more, that payout was even higher. That was why these hospitals had to follow these guidelines, these protocols.
It's critical. We have to like lead the system that's doing this. And so let's 96 hours, they're on a ventilator. They're basically gone. But there's another reason why they want the 96 hours. What was that?
So they would receive financial incentives if a patient was placed on a ventilator. I don't remember the exact numbers. I want to say it was around $30,000 or $40,000 maybe per intubation per patient. And then if they were on that ventilator for 96 hours or more, that payout was even higher. That was why these hospitals had to follow these guidelines, these protocols, like to the letter. Otherwise, they would not get these massive financial incentives that went along with them. And what was interesting is that, depending on the state that you lived in, from COVID positive test to toe tag, you were looking at about $500,000 per COVID admission, COVID admission. And people don't understand that. I've not found a really nice way to say that hospitals were murdering patients for profit, but that's what was happening. Clearly, that's what was happening. I've always, like I said, I've been in healthcare for a long time, and I've always understood.
Bonus for them. So
yeah, exactly.
Yeah, come on, let's start that process. So, yeah, I mean, we're kind of joking around here, but this is obviously very serious. So I talked about doing this show with you, and the amount of money that some of these hospitals were probably, a lot of them were making, and someone in California, I'm not going to say the hospital name, but it's a very high-end hospital. They have many hospitals in California. He said that he was a high-end maintenance guy, so he went everywhere, and he said all of the staff, they promise each other, we will never go to these hospitals. And they started going to, like you've started, outside, healthcare. And he said that that hospital that was making all this money from the patients, they created these huge new wings of hospitals and all kind of crazy stuff from the profit.
Oh yeah. Yeah, they sure did. And yeah, you ask any nurse and they'll tell you, or any healthcare professional that works in the system for any length of time, they don't go to hospitals. And there's a reason why. We understand. And even before COVID, preventable medical error is the third leading cause of death in the United States. So that's even just aside from COVID. And many people will say, well, I can't believe you would question the doctors. Well, I fear the day when nurses are too afraid to question a doctor's order, because you would be absolutely horrified if you understood and knew how many times we have had to intervene and save a patient from a doctor's order. You would be horrified to understand how many times that happens.
Wow. Well, thanks to you nurses. God.
Well, for the ones that are left, because I'm telling you, this newer breed of nurses, I'm a little frightened for, because they're afraid and they don't question anything. They're not being trained appropriately anymore. They're kind of trained to be automatons.
Yeah. And you even talked about that as well on another show, where you said that they started, having these mandates that you guys had to follow. And someone would follow you to make sure you're, doing the right protocol treatment. And one time they had like a monitor on you, and you stayed a little bit longer than they, felt was good.
Yeah. It's like a little low jack. They would put it on your badge, and it does. It's a tracker, and it tracks you for how long you're in like a patient room or what have you. And I actually got dinged on it because I was in the patient room. They said too long providing patient care. I'm like, how can you be in a patient room for too long providing patient care? That made no sense to me. But they're looking at productivity and all of that. I mean, I worked in an ICU, only have 2 patients. So.
Wow.
Yeah.
And so then they wanted the, no resuscitate from patients. God, tell us about that.
Yeah, that was a rough one. That was that same woman we were talking about earlier, where, she started crashing and she had that tear coming down. She was a young woman. She was only 51 years old. She was a young, otherwise, fairly healthy woman. So when I say that these patients didn't need to die, listen, these patients were not frail and elderly patients. They were young and healthy. And so she was a full code when she came in there, as young as she was and as healthy as she was, but they kept pushing. They wanted to call the family, and because she had coded several times. Her heart had stopped several times. We got her back, and they just kept pushing. They wanted the family to make her DNR, and the family was very adamant that they were not going to do that. Her children were very adamant, but they kept pushing for it, and I had a real problem with that we were just going to just make them all a DNR, just let them die, and then, make room, open up a bed and make room for your next $500,000 COVID admission.
Wow.
Yeah.
God, that's crazy. So that was, and to get the family to sign the DNR, it's like, you want to see your family, loved one for one last time, sign this DNR.
Yes. So what would happen when they would say, "Oh, we cannot have any visitors up here because, of course it's the deadliest pandemic we've ever had, right? But as soon as you made that patient a DNR and put them on comfort measures only, then they would let the family come up. So which is it? Is it the deadliest pandemic known to man, or does it not matter once you make this patient a DNR? So that was another thing that really bothered me and again made no sense.
Yeah. And the PPE, the personal protection equipment, you talk about how there were standards that you guys had, which makes complete sense. You're in one room and you don't know what this person has, or if they do have COVID. You don't want
to bring a styrofoam cup out of a room. Like, you cannot, infection control policy doesn't allow you to do that. You can't take a cup out of the room and refill it. No, you have to get a new cup every time. Wow. But yet it was, all of a sudden it was okay that we could be wearing the same mask. And again, people were thinking, oh, that's just a COVID unit. That's not correct. We had both COVID and non-COVID patients on our unit.
Yeah, and one of the arguments was we don't have enough PPE, but you talk about how they had tons of it down in the basement.
Oh yes, yeah. They kept it under lock and key. It was ridiculous. And then the doctors, who we could barely get it was pretty funny. We could barely get the doctors on the floor. And they would say, oh, we're trying to preserve the PPE for the nurses, but they were literally afraid to come up. They were taking the nurses' assessment, or they would, maybe we had some of the intensivists that would come up, but the regular doctors that would round, they would not come near that floor during COVID. And under the guise of they are saving the PPE for the nurses, but they would literally ration it out. And every day when you would start your shift, you'd have to go down. It's under lock and key, and you get your 3 masks. Typically we work 3 12-hour shifts. They would get the mask. They would have us put the mask in this magical brown paper bag that's supposedly sanitized. I'm talking like a lunch bag, right? Oh. They would make us put it in that, and then that would supposedly make it all,